Dopamine is not just a feel-good brain chemical. In critical care, it's a life-saving injection. Today, I'm breaking down exactly what dopamine injection does, the side effects you must watch out for, and why most patients never see it coming. Dopamine injection is a powerful drug used during shock, heart attacks, surgery, trauma, heart failure, and kidney failure. It boosts the heart's pumping strength and improves blood flow, especially to the kidneys. Let's talk a little more about how it works. Dopamine is a synthetic version of a natural body chemical. It's delivered by intravenous drip under close medical monitoring and adjusted carefully depending on your heart rate, blood pressure, and kidney output. Dopamine keeps your organs alive when everything is crashing down. Here are a few important warnings. Tell your caregivers if you have hardened arteries, circulation problems, diabetes, frostbite, Berger's disease, asthma, sulfite allergy, or a history of blood clots. Tell your doctor about all the prescription and over-the-counter medications you use, especially if you've used a monoamine oxidase inhibitor such as furoxone, Marplan, Nardil, Azilect, Eldepril, Emsym, Zelapar, or Parnate in the last 21 days. In an emergency situation, it may not be possible to tell your caregivers about your health conditions. Make sure any doctor caring for you afterward knows you have received this medicine. Are you learning something valuable right now? Smash the like button. Subscribe for straight-to-the-point drug guides like this. Check the description for trusted health supplements and my book recommendations. Now, let's talk about what you should know before taking dopamine injection. You should not be treated with dopamine if you have pheochromocytoma, a tumor of the adrenal gland. If possible, before you receive dopamine, tell your doctor if you've ever had a heart rhythm disorder, coronary artery disease, that is, clogged arteries, a blood clot, an allergy to any foods or drugs, asthma or sulfite allergy, metabolic acidosis, diabetes, circulation problems such as Raynaud's syndrome, frostbite, Berger's disease, or if you have used a monoamine oxidase inhibitor in the past 21 days, such as isocarboxazid, linezolid, methylene blue injection, phenelzyne, razagiline, selegiline, tranylcypromine, and others. In an emergency situation, it may not be possible to tell your caregivers if you are pregnant or breastfeeding. Make sure any doctor caring for your pregnancy or your baby knows you have received this medicine. All right, how is dopamine injection given? Dopamine is injected into a vein through an intravenous route. A healthcare provider will give you this injection. Tell your caregivers if you feel any burning, pain, or swelling around the intravenous needle when dopamine injection is injected. Your breathing, blood pressure, oxygen levels, kidney function, and other vital signs will be watched closely while you're receiving dopamine injection. Please call for emergency medical help if you have signs of an allergic reaction to dopamine like hives, difficult breathing, swelling of your face, lips, tongue, or throat. Tell your caregivers at once if you have a lightheaded feeling, like you might pass out, even while lying down, or you have chest pain, fast, slow, or pounding heartbeats, shortness of breath, cold feeling, numbness, or blue-colored appearance in your hands or feet, or darkening or skin changes in your hands or feet. Now, let's talk about the major side effects of dopamine. The most common dopamine side effects may include headache, feeling anxious, nausea, vomiting, or chills and goosebumps. I'm sure you may want to ask, what other drugs will affect dopamine? Yes, other drugs may interact with dopamine, including prescription and over-the-counter medicines, vitamins, and herbal products. Tell your doctor about all your current medicines and any medicine you start or stop using. In conclusion, dopamine can be life-saving, but it demands careful monitoring and expert dosing. Knowing how it works helps you and your loved ones navigate critical medical emergencies more confidently. Thanks for watching. Hit subscribe and turn on notifications for more life-saving drug guides. Don't forget to check the description for helpful links to support your health journey.